Have you been wondering whether labor is about to start? Maybe you've lost your mucus plug. Maybe you're having cramps, diarrhea, nausea, or that shocking sensation people call lightning crotch. Or maybe you've suddenly found yourself cleaning every corner of your house at midnight and wondering if that's a sign your baby is coming soon. The truth is that labor doesn't usually begin with one dramatic sign. For most women, it starts with a series of subtle changes that can happen over hours, days, or even weeks before active labor begins. In today's video, we're going to talk about the most common early signs of labor, including losing your mucus plug, bloody show, lightning crotch, nesting, diarrhea and loose stools, cramping, nausea, contractions. We'll also discuss which signs actually indicate labor is starting and which signs simply suggest that your body is preparing for birth. And make sure you stay until the end, because I'll explain the one sign that truly confirms labor is happening. Let's get started. Sign number 1, losing your mucus plug. Let's start with one of the most talked about labor signs, the mucus plug. Throughout pregnancy, your cervix is sealed with a thick collection of mucus known as the mucus plug. Its job isn't to keep the baby inside. Instead, it acts as a protective barrier that helps prevent bacteria and infections from entering the uterus. As your body prepares for labor, your cervix begins to soften, thin out, and gradually open. As this happens, the mucus plug may come loose and exit the body. Some women notice one large blob of mucus. Others see increased discharge over several days. The mucus can be clear, yellowish, pink, brown, or streaked with blood. So does losing your mucus plug mean labor is starting? Not necessarily. For some women, labor begins within hours. For others, labor may still be days or even weeks away. That's because your body can actually continue producing mucus, and the cervix can change gradually over time. Think of losing your mucus plug as a sign that your body is moving in the right direction, not a guarantee that labor is imminent. Sign number 2, bloody show. Another common sign of approaching labor is something called a bloody show. A bloody show occurs when small blood vessels in the cervix break as the cervix begins to soften and dilate. You may notice pink discharge, brown mucus, blood-streaked mucus, light red spotting mixed with discharge. This is usually normal and often happens in the days leading up to labor. However, it's important to know the difference between a bloody show and actual bleeding. A bloody show is typically light and mixed with mucus. Heavy, bright red bleeding is different. If you're soaking a pad, passing large clots, or experiencing significant bleeding, contact your healthcare provider immediately because that is not considered a normal labor sign. Understanding the difference can help you stay calm while also recognizing when medical attention may be needed. Sign number 3, lightning crotch. Let's talk about a symptom with a memorable name, lightning crotch. If you've experienced it, you probably understand exactly why it's called that. Lightning crotch feels like a sudden, sharp electric shock sensation in the vagina, pelvis, rectum, or groin area. It can stop you in your tracks. The pain is usually brief, lasting only a few seconds, but it can be surprisingly intense. So what causes it? In most cases, your baby is moving lower into the pelvis and putting pressure on nerves near the cervix and pelvic floor. As labor approaches, this pressure often increases. Does lightning crotch mean labor is starting? Not directly. However, it does suggest that your baby is moving into a favorable position for birth. It's often a sign that your body is progressing and preparing for labor. Prenatal stretching, movement, and pelvic floor relaxation exercises may help reduce some of this discomfort. Sign number 4, nesting. Have you suddenly felt an overwhelming urge to organize your pantry, wash every baby blanket, clean the baseboards, and rearrange the nursery? That's what many people call nesting. Nesting is a burst of energy and motivation that often occurs during the final weeks of pregnancy. Many women feel a strong desire to prepare their homes before the baby arrives. You may find yourself cleaning excessively, organizing closets, washing baby clothes, preparing meals, finishing unfinished projects. While nesting is extremely common, it isn't a scientifically reliable predictor of labor. Some women experience nesting days before labor. Others feel it weeks beforehand, and some never experience it at all. What's important is using this energy wisely. Avoid exhausting yourself. Stay hydrated. Take breaks. And remember that rest is just as important as preparation. Your body is doing incredible work behind the scenes. Sign number 5, diarrhea and loose stools. One labor sign that often surprises women is diarrhea. As labor approaches, your body releases hormones called prostaglandins. These hormones help soften and prepare the cervix for labor, but prostaglandins don't only affect the cervix, they can also stimulate the bowels. As a result, many women experience loose stools, frequent bowel movements, mild diarrhea, digestive changes. This is actually your body's way of clearing out the digestive system before labor. Some women notice these symptoms several days before labor. Others experience them during early labor itself. If your due date is approaching and you suddenly notice digestive changes along with other labor signs, your body may be preparing for birth. Sign number 6, cramping. Cramping is another very common early labor symptom. Many women describe these cramps as feeling similar to menstrual cramps. You might feel them in the lower abdomen, the lower back, the pelvis, the upper thighs. In early labor, contractions can initially feel just like strong period cramps. The key difference is what happens over time. True labor contractions become stronger, longer, more regular, closer together. If your cramps remain irregular and eventually disappear, they may simply be practice contractions. But if they continue to build in intensity and frequency, labor may be starting. This is one reason timing contractions can be helpful. Patterns matter. Sign number 7, nausea. Nausea can also appear as labor approaches. Again, hormones are usually responsible. As prostaglandin levels rise and labor-related changes begin, some women experience nausea, upset stomach, loss of appetite, occasional vomiting. Many women think they might be getting sick. However, if nausea is accompanied by cramping, contractions, pelvic pressure, or loose stools, labor could be the real explanation. Every labor experience is different. Some women never experience nausea. Others feel it throughout early labor. Sign number 8, increased pelvic pressure. As your baby moves deeper into the pelvis, you may notice a significant increase in pressure. Many women describe feeling like the baby is sitting very low. Walking is more difficult. There's pressure on the bladder. They constantly need to use the bathroom. This is often called baby dropping or lightening. For first-time mothers, it may happen weeks before labor. For women who have given birth before, it may happen much closer to labor. While pelvic pressure alone doesn't confirm labor, it's often one more piece of the puzzle. The one sign that truly confirms labor. After talking about all these possible signs, here's the most important thing to remember. The only reliable way to know labor is truly beginning is through contractions that become progressively stronger, longer, and closer together. True labor contractions. Follow a pattern. Increase in intensity, continue despite movement or rest, gradually become more frequent. Many providers use the 5-1-1 rule. Contractions are occurring every 5 minutes, lasting 1 minute each for at least 1 hour. This isn't perfect for everyone, but it provides a useful guideline. When contractions are consistently progressing, labor is usually underway. Conclusion. So let's quickly review the early signs of labor. Checkmark mucus, plug loss, checkmark. Bloody show, checkmark. Lightening crotch, checkmark. Nesting, checkmark. Diarrhea, checkmark. Cramping, checkmark. Nausea, check increased pelvic pressure. And most importantly, check regular contractions that grow stronger and closer together. Remember, every pregnancy is different. And every labor story is unique. You may experience all of these signs, only a few of them, or something completely different. What's most important is paying attention to your body, staying informed, and communicating with your healthcare provider whenever you have concerns. If you found this video helpful, don't forget to like, subscribe, and share it with another expecting mom. Thank you so much for watching, and I'll see you in the next video.